What is the most common sexually transmitted infection in the world? HPV, also called human papillomavirus, is the most common STI globally. HPV is an infection that is spread through sexual contact. The human papillomavirus, or HPV, is quite common. Many individuals have no symptoms and the infection may disappear on its own. However, some kinds of HPV can cause cervical cancer, head and neck cancer, or cancer of the anus or penis. HPV is not a single virus. More than 100 different varieties of HPV exist, with more risk than other viruses. Types of HPV: 1. High risk HPV. 2. Low risk HPV. HPV 16 and 18 are two high risk HPV strains that are responsible for around 70% of cervical cancers. There are a few more high risk human papillomaviruses as well, including types 31, 33, 45, 52, and 58. Low risk HPV strains, such as HPV 6 and 11, are responsible for almost 90% of genital warts, which rarely progress to malignancy. These growths may appear as bumps. Symptoms of HPV. In many cases, HPV infections go unnoticed for years and being naturally cleared by the body. But a low-risk HPV infection appears as warts-like. 1. Genital warts. It either has elevated bumps or flat areas. In females, they typically develop on the vulva. However, they can also be seen on the anus, cervix, or vagina. They can appear on the penis, scrotum, or anus in men. 2. Common warts. Usually, the hands and fingers are affected by these rough lumps. 3. Plantar warts. The bottom of your foot might develop painful, hard, gritty lumps called plantar warts. 4. Flat warts. These have a flat top and are a little elevated. They can appear anywhere, but are most frequent on the face and legs. HPV causes and risk factors. Your body becomes infected with the human papillomavirus by a cut, scrape, or tear in your skin. Skin-to-skin contact, anal, vaginal, or oral intercourse are all ways to contract it. If you have genital warts while pregnant, you run the risk of passing HPV to your unborn child. Rarely, this may result in a benign growth in your baby's voice box. HPV detection. By simply looking at your warts, your doctor might be able to determine if you have HPV. But even if you don't have any obvious symptoms, they can still do a number of tests. Test with vinegar solution, pap smear, DNA analysis, HPV therapies. Warts may disappear on their own, especially in young children. Salicylic acid gel, imiquimod gel, and podophylox gel are among the drugs that can be used to treat them. Other treatments for them include surgery, cryotherapy, electrocautery, electrification, and laser surgery. Immunization is the best way to prevent HPV. You can also reduce your risk by limiting the number of sex partners you have. Avoid making immediate contact. For more such informative videos, like and subscribe to our channel MEDWIKI.